The study involving Enfortumab vedotin and Pembrolizumab, which has been previously reported, was updated at ASCO 2021. The abstract focused on time to event endpoints, looking at updated progression-free survival and overall survival. And in particular, the overall survival data had not yet been reported because it wasn't mature. And so the overall survival that we observed in this single-arm study was 26 months in a patient population where historically the life expectancy is around 9 months. And so this is really a dramatic sea change if it's replicated in subsequent trials. There is, the caveats, of course, that this is a single-arm study with 45 patients, and perhaps the data, might not be quite as good as what that suggests so far. But boy, this is a real difference than what we've seen in the past. And in fact, in an all-comer cisplatin-eligible population, this is arguably the best data we've seen in a prospective trial. There are 2 confirmatory studies going on. One is a separate expansion cohort on the same study, randomizing very similar patients, identical types of patients, cisplatin-eligible metastatic urothelial cancer who have not received prior therapy to either Enfortumab vedotin by itself or Enfortumab vedotin plus Pembrolizumab, to try to understand what's the relative contribution of Pembrolizumab to this. And that study is ongoing. Accrual is going well, but is not yet complete. And so we hope to see those results in the coming years. There's also a randomized phase 3 trial looking at Enfortumab vedotin plus Pembrolizumab in comparison to standard chemotherapy with gemcitabine and platinum, depending on whether you're cisplatin eligible or cisplatin ineligible. And that study is actually looking to see whether or not it can replace first-line chemotherapy, period. We know that first-line chemotherapy with gemcitabine and platinum is a standard of care at this point, followed by avelumab maintenance. And those results in the responding or stable disease patients look much better than just doing chemotherapy in observation until relapse. But the way this study is designed, and these studies are designed, is that there is pembrolizumab maintenance built in to the Enfortumab vedotin arm. And so it eventually will, I suspect it might replace platinum chemotherapy for some patients, maybe even most patients in the first-line setting. But that needs to be determined based on the ongoing studies. But certainly seeing a progression-free survival of just over a year and an overall survival over 2 years in a cisplatin-eligible patient population is really unheard of.